Mark and Paulette here, the two travelers in Mexico, and we're going to talk medical this time and how to find medical services here in Mexico. And we have three guests with us.
Yeah,
and
hello.
Well, please introduce yourself.
Hi, my name is Edgar. I'm the CEO of this business, and I'm going to be having the honor to talk with Mark and Paulette about what we do and why we want to reach you.
And what is the name of your business?
The name of the company is MD. It's like medical doctor, but with double E, MD.
Okay. mdee.com.mx.
Our website is mdhealth.com.
Oh, mdhealth.com? Okay.
Yeah.
Okay.
Hi, this is David. I'm Dr. David Ancona. I'm a specialist in ophthalmology. I am one of the founders of this company that we hold close to our hearts, and we're very happy to share with you guys everything that that we do on our everyday.
Okay, and next?
And I am Victor. Hello, guys. Thank you for having us in your channel.
You're welcome.
I'm the financial officer of this company. I'm the matters of finance and regulatory matters are at my charge. But I don't want to bore you with this stuff.
He's the money man.
Money man.
Yeah.
Very important.
Very important.
If you guys could talk about why you started your company, what you saw that was missing in the healthcare system that you're trying to
You want to start that one, Ariel?
Yeah, well,
Okay.
Thank you for the question. The first thing that came to our mind is that health is a right. It's not a privilege. It is something that every person that needs to solve any kind of problem should have a way to do it. And after that, we make our little research on the internet, several statistical web pages, and we find out that in the United States, about 20% of the population is uninsured, which is, we are talking about 60 million people. And beside that, there is also a phenomena that is called like underinsurance. There is a lot of people that it's probably covered, but their insurance is not covering like everything they need. And it is also a very stressing situation for someone who is facing an ailment. Ailments can have a big spectrum from something really easy to solve, from something very, very complex like probably cancer or something like that. So that's why we decided to gather a group of several professionals ranging from medical doctors, actuaries, computer science engineers, and communicologists, marketing people, and say, hey guys, we should have a service that might positively impact the life of the people, right? Without ripping them off. That's part of that was cooking in our mind. We said we defined it that to have a solution that is not affordable for a huge segment of the population, it is not a solution, right? And after that, we realized that here in Mexico we have very, very competent profiles, and I'm not talking only about the medical expertise, but also about the nurses, also about the technology that some hospitals here in Mexico have access to, because it is imported from the United States. But there is a huge difference, and that difference is the price. We gotta talk about the price, because here in Mexico you can get like exactly the same treatment, in many cases with 70% of savings. 70%.
And the same kind of equipment and all that.
Yeah.
Exactly.
Yeah.
It's like the same technology, it's like the same protocol, it's exactly the same. With a very important factor, and that factor is that we believe at Bendy that the main axis of your treatment should not be your insurer, not an agency, not the government, but your doctor. Your doctor must be the one responsible of the decisions that you are facing. He must be your main advisor. And here in Mexico, well, with us, you might have that option. I don't know, David, if you wanna further in that explanation.
Well, I think Edgar covered most of it. what I would say the most important thing is that we believe that people should be treated as such. I think through a lot of, I mean, capitalism has good stuff, but also things that could be improved. And one is like maybe exploring more about the quality of the human being. So we are very concerned about security of our patients, and also working with the top of technology, but also taking into account that we're treating with people. So as a doctor, I definitely want to get to know my patients better and understand how can I help them better in their own specific little world, and I will give them my best advice with the knowledge that I have gathered through time, right?
Why don't you tell a little bit about yourself, like where you studied and what you specialize in, and the one-on-one patient-doctor care.
Let me do that part for you.
No, so I'm an ophthalmologist. I'm originally from a little island in the Caribbean, Mexican Caribbean, called Cozumel. I really invite you guys to visit it sometime. Really nice beaches over there, and the seafood is amazing if you guys are into that too. And I did my medical training in Mexico City, where I did first med school and then ophthalmology, and specialized after that in retina. After that, I got a call from a very prestigious hospital in Philadelphia, Wilside Hospital, in a program that only accepts 2 people worldwide to specialize in ocular cancer. So I'm now a specialist in eye cancer. And after that, I got to experience a lot about how to treat people with these very specific conditions, very hard to treat conditions. And that's what inspired me into get back to my country to help people with these conditions that are often forgotten and very highly curable. So that's what we're doing here, and basically that's to sum it all.
So your company, you specialize in helping people from the United States and other countries find affordable medical care.
That's it.
Do you want to talk
in
about
Mexico that's top notch.
You want to talk about that a little bit, Ariel?
About
how
affordability?
about like how you guys are accessible to help other people, how you coordinate, like the doctors and things like that in the different areas.
Mm-hmm.
Yeah, well, that's talking about the process, right?
Right.
Yeah.
Well, the first step is to know the people. You have to be noticed by us.
Mm-hmm.
We have like the first filter is our international coordinator, and he's gonna have a little interview with you with no charge about what is your condition, what are you facing, which is the diagnosis that you already have, if you have any testing with you, testing results, then
Records or whatever you want.
whatever it's involved in your situation, he's gonna interview you about that. The second step is that with medical assistance, he's going to turn that case to the right specialist for you. Probably you will have an appointment with that specialist to talk about in further detail with that person. It is a call from 60 minutes. It's where you can explore like why are you seeking help and why is the reason you are trying to have your issue solved. And after that, it's not like a standard process because every patient is very different. But the first thing we must understand is that what kind of problem do you have, and if it's going to be valuable for you to come across, right? Because if there is something like that can be solved easily in your country, we are not going to suggest you to come to do that. And our main driver is health first, always, right? So I would say like it's a very, very simple process. You just come to us, to our website or our Facebook or probably our Twitter or our Instagram. There are several ways to contact us. And after that, well, the process is going to be very, very personalized for you. One thing that we want to do also is to be very transparent with the cost. In our research, we found out that in the States, many people is many times worried about the billing. because you go to the hospital and you don't know if your doctor is going to be in network, out of network, if he's going to charge you how much. That is something that we want to erase from the map, because once we have a complete assessment of what you are facing, we are able to provide a quantity that is like 98% accurate to what are you gonna be paying, right? Right now, I gotta say we are not able to provide attention with insurance, because insurance companies in the States are a really complex system, extremely complex system. But we are here talking about out-of-pocket expenses, but we are very sure that it is a very, very competent, and we can promise you that you're gonna have access to the very best of Mexico of our efforts. Yeah.
Now, and you offer consultations in English?
Oh yes, of course. Every single one of the doctors working with us are able to provide consultation in English, so you don't have a language barrier or something. We are so obsessed about the quality of the treatment and the quality we are able to provide, that every single doctor was subjected to a little test with a specialist translator that give us a diagnosis if the doctor is able to provide a consultation fully in English or not. We gotta say this, that if the doctor doesn't fails in the test, unluckily he cannot be part of our network, right?
Okay. Now, we've been talking mostly about people coming to Mexico from the United States looking for medical insurance, but what about, say, the people, the Americans that are already in Mexico, but something happens and they need medical attention in some way? Do you have a service for that too?
Yes, we have. The spectrum of services that we are able to offer is huge, like from consultations, procedures, second opinions that are very important, lab testing, image testing, and it's not closed like for Americans living outside. If you have a problem and you are living here in Mexico, we are going to be able to provide a solution for you too. Yeah. No problem at all. I don't know if you want to give a little more detail.
We would like to be considered a trusted directory of doctors that have gone through a process of selection with plenty of experience or that are top of their field and are very easy to communicate with. So you wouldn't feel that you are leaving something in translation. We are very thorough with this because we care a lot about security, I would say, and we would refer you to somebody that we feel that could treat our own very family, right? Like this is also a network we have used it before with our own network, who will also go to us and to find out who can they refer their patients to, and we're a strong network of doctors that trust each other. Let's say that, because so I would say if you wanna search for a good doctor that fills your needs, we would be happy to help you as a directory to find that person near where you are.
Okay. Now, my next question is: do you cover all of Mexico, or? Okay.
Okay, that's a very good question. The simple answer is no. Our main concern for our patients is security, accessibility, and affordability. Unluckily, in our country, there are clusters very, very located in the country, because Mexico is huge, right?
Yeah.
So in many cases, we know that people want to go to the beach or to Cancun or some Puerto Vallarta, which are very, very traditional. But in many times, these places doesn't have a robust strategy to cover a huge range of, I would say, necessities, right?
Right.
So we strongly encourage our patients to come mainly to Mexico City, Monterrey, Guadalajara, and Boca del Rio in Veracruz, because in there we have developed agreements with third-level hospitals, short stay clinics, advanced imaging laboratories to make the work, to have the work done. Okay? These places are very, very specific because they have like basically everything that you might need in your treatment.
Right.
So that's the answer. No, we are not able to provide attention in Cancun if you seriously and
But
you want to go to the
if-
beach.
If they, it doesn't matter where they live. If they come to one of the cities that you're in, then they'll still be able to get treatment.
Exactly.
Okay.
Also something that is quite important is that like Edgar said, that surgery is going to be performed in a safe place, which is also a very huge risk when people are trying to find a doctor for their needs, right? And that's not maybe for everybody, but for people that are searching for something that is surgical, that gives them comfort, and to us too, right? That we have the backs of the doctors that are already there.
So they don't need to worry about that.
Not at all.
That's not a concern because you guys have already done all your homework.
Correct. Yep.
So
And on top of that, if you by some chance are not from that city, we can also help you with transportation and accommodation too. If you want, because people sometimes want to do it themselves, and with the help of a companion that will be with you the whole trip. So that hotels are usually very close to the hospitals in safe areas also, because that's also here in Mexico, you don't know where you are, right? You might be walking around a not so sure place, but they're pretty sure they're very secure places that we have we've found that it's very, very safe for our patients there. So basically that. We expand the service also to transportation and accommodation. In the end, people find that the overall expense lowers even more if they do it themselves. But we're happy to also work with that if that's the case of they want to take into their own hands finding accommodation and transportation.
Some of your services may be eligible
Yeah.
for
Yeah.
tax deductible
Yes.
under some U.S. codes.
Yeah, sure. Yeah, in fact, don't worry for the billing. We have built a strategy that allows us to be eligible for tax deduction in most of the states in the United States. We build that, and it certainly works for your tax refunds, and that's very important because maybe most of the insurer companies or targets maybe are not insured, but don't worry for your tax deductions, it will be eligible. And we make this framework to allow us to do that. Yep.
that's
So
great.
yep. I mean, of course, you should consult your local accountant because in the United States it's very tricky
Right.
the state regulations, but in general it's deductible. Yep.
Nice.
Okay.
Another important part of our core as a company is giving back. We strongly believe that we are able to generate value for several segments, from Americans trying to solve a health issue to very vulnerable segments here in Mexico, or even coming from the States. We are open to that. So that's why when we make the negotiation with our MDs to be part of us, they signed an agreement saying that after certain number of surgeries, they're gonna provide one for free for a person who is very much in need, right? Because
That's awesome.
again, we believe that everyone should have access to that. It is impossible to do it like out of nowhere. That's why we need people fueling that strategy, so that these doctors can provide services for someone who definitely, without any question, is unable to pay by themselves. So that's part of MD. And let me tell you guys that we are obsessed about the details. For example, here at MD, we also make the efforts with a Mexican bank to have the best rate possible for your dollars, right? Whenever you come from the States and you have to turn your money to our money,
Convert it. Conversion.
you can you can burn a little bit of it, and that is not going to happen with us, because we have done our homework, we have an agreement with the bank, and we are able to provide you with the best rate in the market at that moment,
The preferred.
without any doubt. That is also a driver for us. Another thing that I might say is our main concern is health. We are obsessed here at the MD. We are obsessed for the details, and we are able to provide you with the best rate for your dollars in the market. That's that is something that is going to happen with us. I don't know. The thing that is going to happen if you decide to contact us is that you're gonna have a very, very clear picture of which is the process, where is gonna be the process, what are the drivers involved, how much are you gonna pay for that, and you're gonna have something that we understand as transparency. Like, we're gonna use these dollars for anesthesia, we're gonna use these dollars for, I don't know, probably lab testing, we're gonna use these dollars for, you're gonna have like the total security,
Very detailed.
a very, very detailed in advance of what you are gonna be facing and why, right? Something I might add is that many people make this question, that is it possible to get an even cheaper rate for these services in Mexico? And the answer, me being the CEO, is yes, absolutely yes. It is very possible to get even lower prices for the very same kind of services, but we are doing here all the job to provide as much quality as possible, right? With the best hospitals, with the best doctors, with the best nurses, with the best every single driver in the process to fix your problem. Let me have an example. Like, if a patient comes with an ailment from your heart, and this patient needs a surgery in the heart, we are going to strongly suggest that patient to go to the National Institute of Cardiology. We have the agreements, we have the way to get this patient to the very best hospital of cardiology here in Mexico, because our cardiologists are part of the core body of the hospital, right? So we are gonna have like the suggestion that is right for you. If you're gonna need a cataract surgery, which is a very complex procedure, but it's not that complex like to threaten your life, we're gonna get you to the most suitable operating room available in the city to solve that issue. So again, just give us an opportunity and have a communication with us, and you're going to be able to realize that we are not looking for your money. We are looking to solve your health problem at a very, very good cost with the very best of Mexico.
Remember that to ask the advice of or an estimate in cost is completely free of charge, right? So that's also if you're looking to compare something that you already found, we'd be happy to provide you with a very accurate description of the possible costs that your condition needs. So I would advise anybody that's concerned about their health here and are living currently in Mexico to approach us, and would be happy to help you with maybe telling you where to go and at the least possible price and the most value for your dollars, right? So yeah, like Edgar said, we're very concerned about the community, and we like to give back as human beings and as people. It is at the core of our company to leave something that is greater than us, right? And currently we have several programs that are focused towards right now visual health in terms of providing free surgeries for people in need. If you want to know more about that, we'll be happy to provide you with information.
And then give your the link again, that if they need information, where they can go to find it.
Sure. So that's mdhealth.com, mdeehealth.com. And the social, I would guess in the description box you can find the social media links, and we'll be happy to assist you with any question that you might have regarding your health.
And just let us help you with you don't have nothing to lose. I'm sure you won't regret of calling us.
You'll have everything to gain.
Of course.
Yeah, what these gentlemen are talking about, Paulette and I have experienced already. It's not, in Mexico, medicine is not about making a dollar off of you, and it's not about profit or anything like that. We've found that in general, our medical visits in Mexico have been very personal. Doctors take as long as they need to with you so that you perfectly understand. And with Paulette and I not having mastered Spanish yet, they've had to take a little longer with us, but they've always been very helpful, very patient, and this is the same kind of service that you guys offer as well.
Yeah, definitely. I just want to tell you guys that we are very proud of. We have a lot of pride for our doctors. The profile that is working with us is, believe me, the very best doctors here in Mexico. They are leaders in their fields, and medical education and medical training in Mexico is heavily regulated. This is something that most people doesn't know, but here in Mexico, the National Autonomous University of Mexico is in charge of that regulation, right? So when you are having attention with these guys, you have to make sure you might rest assured that they are very top profiles. Well, we are very proud of them. There is a little phenomenon I would like to comment on.
Sure.
That, for example, an ophthalmologist here in Mexico that is specialized.
There's some music down here, you guys.
Yeah.
Mexico, right?
That is Mexico. Okay, so I was telling that if you compare the performance of an ophthalmologist here in Mexico to the one in America at the very same age, let's say 40 years, I have to say this: here in Mexico, that ophthalmologist has had a lot more exposure to these cases, because formation in many cases implies that they should go to very poor places in Mexico to perform those surgeries. Probably an ophthalmologist in his 40s has already had like 3,000
Right.
3,000 and 1,500 cataract surgeries, right? Which is a lot more than an American ophthalmologist. I'm not trying to be shady.
Right.
It's like just they have a lot of exposure to these cases here in the country, right? I don't know if you want to comment on that.
On that, there was a study that was comparing the number of cataract surgeries, which is what we do a lot, compared to, for example, the standard ophthalmologist in the U.S. might do 700 surgeries in a year, right? Here it's up to 7,000 per ophthalmologist, so that's 10 times. So, like Edgar was saying, we get a lot of exposure because it's very crowded. We don't have as many doctors, maybe, and also all the social programs we do is towards perfecting, the surgical techniques and everything. So it ends up being very efficient, very fast, very safe, and very reproducible. In the end, the experience gathered by, let's say, younger professionals, it tends to be comparable to people that have been 20 to 30 years in the area. So that's very important to keep in mind. That's why there's excellent doctors in India. As you know, there's a little bit of everything in every country, right? But like where it's safe, India's top notch in a lot of medical conditions. We just wanted to put a little bit of emphasis towards the range of medical specialties that we work with, and that extends not only to surgeries, like we said. We have plastic surgery, we have ophthalmology, gynecology. We have pretty much every single one that you can think of, and also extending to mental health, psychiatrists, psychologists too. They don't even need to transport into somewhere else. That it can be via Zoom, so that's very good. And also to remember that it's in English and it's in a native tongue, right? And also nephrologists, cardiologists, and everything else, right? So we'll help you find whatever you're looking for, and that's. I think
we're gonna. Yeah, we're starting to get some raindrops. We're starting to get a little bit noisier here. Everything is coming to life right now. To life in this park that we're in. So we're gonna let you guys go so we don't get wet.
So this is Mark and Paulette, True Travelers in Mexico, and this is just a little different than the videos that we've been making lately. But we felt that a lot of our viewers are interested in medical coverage and what's available to them. And, I want to convey again, the medical service here in Mexico is outstanding.
Absolutely.
Absolutely, yeah. So.
All right, and whenever I end my videos, I always say, what do I say? I always say.
Or you do the blow the kiss.
I always
thing.
say, from the Two Travelers in Mexico, and I go like this. So let's do that together.
And then you want to do that together?
Yeah, I want to do it with everybody.
Okay, and then I'll do the what she said.
Yeah, then you can do what she said.
Okay, I'll do the what they said.
Okay, and as always from Mexico.
What they did.
Bye, guys.
Bye.
Bye bye.